This course will teach you everything you need to know about E&M coding and documentation for established office patients. There are 5 levels of care for these encounters with the documentation requirements shown here. For these visits, only 2 out of 3 key components are needed. Established office visits are the most commonly billed CPT codes on the planet. There are 5 levels of care with a relative reimbursement and distribution of use among internists shown here. As you can see, most of the action takes place between the 99213 and 99214 levels of care. It's important to understand the difference between these 2 codes, because if you recognize the clinical circumstances when it would be appropriate to go from a level 3 to a level 4 visit, you would increase your reimbursement by over 50%. In this video tutorial, we'll go through all 5 E&M codes used for established office patients, focusing on the cognitive labor required for each level of care. Then we'll use real clinical examples to show what each visit looks like in real life when you're actually taking care of patients. Finally, we'll walk you through the process of actually documenting the history, physical exam, and medical decision-making for each level of care, showing you how to maintain compliance while streamlining the documentation to save time. There are 2 standard versions of this course, one using the 1995 guidelines and the other using the 1997 rules. We also have versions available for providers who practice in these states under the Trailblazer Medicare carrier, which uses a different point system to quantify the medical decision-making. This activity has been approved for 2 hours of AMA Category 1 CME, and also for 1/2 CEU by the American Academy of Professional Coders.